So let's look ahead now that we're talking about sustainability in the future, and we have to keep that in order to keep moving forward. What does that look like if everyone is successful with rural health transformation in the next 3 to 5 years? What does that look like?
It'll be a celebration, first of all.
Yeah,
that'll, but again, it depends. It's, I was reading recently about like the state of Wyoming. They are looking at a strategy to essentially take the funding and endow it.
Okay.
So it resides investing those funds, investing the funds into a one of their government vehicles, but then using the proceeds to fund activities in their state, not only over the next 5 years, but also potentially
further down
forever.
The road. Yeah. Okay.
If they make their investments right. That's a really interesting strategy. I know it's being strongly looked at. I haven't checked this week on the status of that, but that's a very thoughtful way to consider the long game.
Yeah.
And how that plays out. But also, it involves different like the work that our partner Cibolo does about payment methodologies and value-based care methodologies for sustainability after the fact. And so, I think going back to, way at the beginning of this, we talked about infrastructure.
Yeah.
And, virtual infrastructure is just important as brick and mortar. And in reality, there's not a lot of brick and mortar in the rural health transformation. You can make upgrades, but you can't build new stuff, really.
Exactly.
And so, that virtual brick and mortar, if you will, is a key part of that.
Absolutely. So when you've talked to all of these different policymakers and you yourself in this realm, what has made you optimistic about this opportunity that we have right now?
A lot of things. Going back and looking at all those state responses that we as an organization responded to, now starting to see some requests for proposal, requests for more information come out. That's I'm really warmed by the fact that we have a system of care, a platform, across the care continuum, from all the way from an ambulance, pre-hospital, all the way out to post-acute in the senior care space. There's a lot of ways in that whole continuum that we have the ability to impact care.
Absolutely.
And that's really warming, especially, all the results that we've been able to achieve over the last few years and being able to educate policymakers about, whether it's, senior care, whether it's school nursing, because a lot of states have some element of school-based care in their plans. Because interesting statistic, and this came to light when we were doing an RFI recently for a state. 67% of the kids in K-12 in this country don't have a primary care provider.
67%.
67%. And so that was really a light on, because if the importance of our...
So their school nurse is their primary care.
Bingo.
Yeah.
That's huge.
Yes.
And if we want to truly improve access to care in rural America, in K-12, virtual could be a way to have that strong impact.
Absolutely.
Same way along with behavioral health. Being able to provide those kiddos access to scheduled therapy appointments via telemedicine, but in the safety and safe surroundings of their school where they're comfortable. Yeah.
That's awesome. Very cool.